Hi, I'm Dr. Cady, and I'd like to welcome all of you and our YouTube audience to this presentation on Autism is Treatable, the first of a series of 4 lectures by our biomedical specialist, Ms. Marcella Piper-Terry, Master of Science. I've worked with Marcy for how long now? Off and on?
Off and on since 2003.
2003.
So almost, yeah, 11 years.
Longer than I'd been married. Yes, since
not me. I've been married longer than that.
Since 2003, and it's been an interesting time.
It has been.
And we've decided we just can't live without each other professionally. So she's back at CWI, and we're collaborating on treating some of our ADHD and autism and autism spectrum munchkins. So I know that, and when I have previously introduced Marcy, I haven't always brought this point up, but it's not that she's just an erudite, sophisticated biomedically practitioner that's just kind of idly interested in this field. She actually has a reason to be passionately interested in this field. And I've asked her, I threw this at her right before we got started, I've asked her to just talk to the YouTube audience out there and talk to the folks here about what really got her attention, because what got her attention certainly got my attention in terms of her life history. So I'm going to turn the rest of the program over to Marcy. Thank you for doing this for us and for everybody out there, Marcy.
Thank you.
Thank you.
Thanks, guys, for coming. Well, as Dr. Cady said, I have a personal reason for why I do what I do. And she is now 20, my daughter, Rachel. And she was vaccine injured as an infant, and she received many different diagnoses, including an Asperger's diagnosis. She was initially diagnosed at 5 with ADHD combined type and OCD, and then went on to develop Asperger's syndrome and something called PANDAS, which is pediatric autoimmune neuropsychiatric disorder associated with streptococcus. It's an autoimmune disease. And she had a lot of difficulties with immune system problems, and so we started doing a lot of changes in diet and supplements and detoxification and those kinds of things, and working to benefit her immune system. She at one point in time was on 5 different psychotropic medications. When she was in the 5th grade. We weaned her off of all of them. She's not on any medication anymore. And we treated seizures, we treated autoimmunity, we have reversed everything. She's lost her diagnoses. She's driving, she's working, and she's now in college. So that's my personal story, and that's why this is something that I really care so much about. So again, I want to thank you guys for coming. Tonight we're going to talk about the fact that autism is treatable. And a lot of people don't think that's true. A lot of people that I see have told me that their children, when they received their diagnosis, the person giving them the diagnosis had said to them, "There's nothing you can do. Your child has autism. You need to think about you need to start thinking about institutionalizing your child." So that's been. And that's why I often have tissues in my office, because everybody cries on that one. And the thing is, it's not true, okay? So this is a quote from Václav Havel that I first heard in 2005 when I went to my first Defeat Autism Now conference, which was put on by the Autism Research Institute in San Diego. "Follow those who seek the truth, but flee from those who have found it." And that really resonated with me, because just like those parents who've been told there's nothing you can do, those are people who've decided, those are the experts who've decided that there is nothing you can do, and they're not willing to look and they're not willing to learn anymore, so they think they found the truth. I say run from them. Truth changes slowly, and at one point in time, the experts decided that the world was flat, and it's obviously not. And we all know that when I was in school anyway, there were 9 planets. Pluto was a planet, right? So now Pluto's no longer a planet. So even in science, you know, really hard science stuff, truth really does change. And in medicine, back in the 1950s, and the 60s, this says, give your throat a vacation, smoke a fresh cigarette. And doctors were promoting cigarettes as being good for you. So things do change. Sometimes we have to wait a while. These two guys, Drs. Barry J. Marshall and J. Robin Warren, they received the Nobel Prize in Physiology or Medicine in 2005, and they received that for their 1982 discovery of the bacterium H. pylori and its role in gastric and peptic ulcer disease. Now, prior to that, everybody thought, that it was stress that causes ulcers. It was stress. It's not, it's not a bacterial infection. It's just stress. And so when they came out with this and they said, no, it's actually a bacterial infection, that was heresy. And so it took from 1982 to 1995, that's 13 years, before antibiotic treatment of H. pylori became the standard of care. So 13 years after they discovered it, before it was finally adopted and became the standard for the treatment of ulcers. So the question for when we talk about autism and neurodevelopmental disabilities, can we afford to wait 13 years? The CDC's new numbers, which were announced in April of 2014, said that 1 in 68 American children now have an autism spectrum disorder, and that's 14.7% out of every 1,000 8-year-olds. That's 1 in 42 boys and 1 in 189 girls. And the kicker is that these are old numbers. They were collected in 2010. So by the time they reported them, those numbers were 4 years old. And because they were collected on 8-year-olds, no children under the age of 12 in 2014 are included in those statistics. The data sampling came from 11 sites, not 11 states, 11 sites, and those sites did not include the areas in the United States that have the highest rate of autism spectrum disorder according to the IDEA, which is the educational data. That's the most complete data that we have on autism spectrum disorders. Only one of the sites of these 11 was in one of the states that is in the top 10 of the IDEA. So it's still an underestimate. It's an underestimate because of the way it was collected, and it's an underestimate because it's 10 years old, or 8 years old when they announced it and didn't include anybody under the age of 12. So what are we really facing? The CDC says this new estimate is roughly 30% higher than the estimate for 2008, which was 1 in 88, and it's roughly 60% higher than the estimate for 2006, which was 1 in 110, and roughly 120% higher than the estimates for 2002 and 2000, which was 1 in 150. The CDC says we don't know what is causing this increase. Some of it may be due to the way children are identified, diagnosed, and served in their local communities, but exactly how much is unknown. And that's a direct quote from the CDC on the autism data. So in 2012, when the CDC came out with the 1 in 88 estimate, it was the same kind of thing. It was, the data was from 4 years earlier, and it was collected on 8-year-olds. So I took that estimate of 1 in 88, and I said, okay, those are 12-year-olds. So if we have a 15%, it's actually 13-point-something% increase yearly. So if we have a 13% increase per year, and we've got 12-year-olds, what does that mean for children who are now 11, and children who are now 10, and children who are now 9 and 8 and 7 and 6 and on down? And I extrapolated the data out to 3-year-olds. And when in 2012, the number for 3-year-olds, if it was 1 in 88 for 12-year-olds, it would be 1 in 29 for 3-year-olds. And now this year in 2014, I did the same thing. If it's 1 in 68, it would be 1 in 21 for 3-year-olds in 2014 and 1 in 18 for 2-year-olds. If something does not change, and the thing is this has been a consistent increase, a consistent yearly increase since 2000. If we extrapolate that out, by 2022, the number is 1 in 9. So the autism prevalence and cost, in 2009, the CDC estimated that there were 270,087 children ages 3 to 22 in the United States. In 2006, according to a study at Harvard School of Public Health, the cost of lifetime care for someone with autism was $3.2 million for one person. And most of that cost occurs after the age of 22 when they age out of the school system. In 2010, the estimate of ASD in the United States, and this is using the CDC's 1 in 88 or 1 in 68 numbers, would be 1,058,400 children between the ages of 3 and 22 years. So now they're saying that the cost, the lifetime cost, it has decreased, and it's now 2,300,000. So that's a considerable decrease from 3.2 million. And what that means is that they're spending less money per child. They're cutting services and they're spending less money. It doesn't mean that it actually costs less to care for a child. It means that they're spending less to care for that child. Okay, so is it better diagnosis? If it's better diagnosis, where are all the autistic adults? You know, how do you miss a child who suddenly stops talking, starts spinning in circles and flapping and self-injury, injuring themselves and injuring others as they get older? That's not easy to miss when you've got one in every classroom. There wasn't one in every classroom when I was growing up in the 60s and 70s. There wasn't one in every classroom in the 80s. But now we've got at least one in every classroom. So how much does genetics count for? This is a quote: genes account for 38% of autism risk, with environmental factors explaining the remaining 62%. And that's from a 2011 study from Stanford University. And there is no such thing as a genetic epidemic. So I actually have some personal experience with this. In the last couple of years, I've worked as a behavior analyst, working with adults in group homes, and also with teenagers in the community, and doing behavior therapy with those folks. And what I noticed was, in the 5 group homes that I worked with, there was a range, an age range from 18 to 80. And a lot of older folks, people 40s, 50s, 60s, 70s, and into their 80s. And a lot of younger folks coming in. Among the people that were in the older age groups, in those living in those group homes, they had a wide variety of diagnoses. They had cerebral palsy, schizophrenia, bipolar disorder, Alzheimer's disease, you know, lots of different dementia and that kind of thing, and a few with autism. I had one in his 50s who had an autism diagnosis, and one in his 40s who had an autism diagnosis. So there was a wide variety of diagnoses, but the ones who were coming in the 18 to 25 range, almost universally with an autism diagnosis. So there's a very big difference between what used to be and what there is now. So the answer is, where are all those autistic adults? They don't exist because it wasn't like this. So this is a poll that was taken a few years back, and over 5,000 parents were asked the question, will my child be independent? When my child is an adult, he or she will live independently, and 8% of those who had a child with autism diagnosis said that their child would be independent. 42% felt like their child would live independently but would require minimal support. 14% felt their child might live in a group home, and 36% felt like their child would probably never leave home. So we've got 50% of parents who felt like their child would probably never be independent. So the goal is to increase the probability of independence. Sidney McDonald Baker is one of the authors of a book called Biomedical Interventions for Autism, and it's called, I refer to it as the Biomedical Bible. He was one of the original medical doctors. He's an MD, one of the original medical doctors involved with the Autism Research Institute and developed the Defeat Autism now, which is no longer in existence, and now it's called MAPS Doctors. But he came up with something called the first tax law. And the first tax law says if you're sitting on a tack, it takes a lot of Risperdal to make it feel good. The appropriate treatment for tack sitting is tack removal. So if there's something in this child that should not be there, then instead of medicating to numb or reduce symptoms, the appropriate treatment is to get whatever that is out. So then the second tax law, Dr. Baker's second tax law, is if you're sitting on 2 tacks, removing one does not produce a 50% improvement. Chronic illness is or becomes multifactorial. This is what's so difficult for a lot of people to understand, because we don't think that way in our society now. We have all of these specialists who say, you know, you go to one doctor for this and one doctor for that and one doctor for this and one doctor for that, and there's one thing wrong with you that they're going to treat. We don't look at ourselves or our children as a whole system that needs to be evaluated, and whatever is contributing to dis-ease, we need to evaluate and treat those issues. So when we start looking at these children, we want to get as much information as possible. So sources of information include a developmental history questionnaire, which is now one that I've developed, and it's about 20-something pages long. I want details, 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 details. So I ask a lot of questions. And some of them, people are like, why did you ask me that question? You know, and I mean, for example, on the front page, it says, if you're, you know, what does your child prefer? What kind of candy does your child prefer? What kind of soda does your child prefer? So some children are orange soda and red licorice kids, or they like Starburst, or they like things that have those fruity, colorful stuff. And some kids are chocolate kids, and chocolate and Coke, or chocolate and Dr. Pepper kids. So why would I ask that? Because it tells me a little bit about whether or not that child might have some issues with red dye, with food dyes, craving those kinds of things. So I ask a lot of questions like that. And then the chronological history, and when I talk about the chronological history, I'm especially interested in looking at their medical history, the pregnancy, medical history from birth. I want to look at their vaccine records. I want to look at their vaccination records, and I want to see their medical history so I can look and see, did this child develop ear infections as mine did within a couple of weeks of getting her 4-month-old shots, or 4-month shots? Did this child, a lot of kids you'll see when you do the vaccine timeline and you marry that timeline up with the medical history, you'll see the child going along and no problems, and then they'll get their vaccines, and then they're in the doctor's office, and then they'll come back down, and then they'll get their vaccines, and they're in the doctor's office again. So you see a lot of bacterial infections, you see a lot of antibiotics and that kind of thing, and all of that affects how a child will respond, or in some cases, child's response. So then also the narrative. I want to know, what did you see? What do you think happened? Because you are the expert on your child. I'm not the expert on your child. I want you to tell me what you think happened. And that's something that really has been emphasized in the group of doctors and professionals that I have learned from and that I really respect, is because, and it's so rare, I think, because we're you know, you go to see a doctor and you might have 3 minutes and they come in and it's like, what are you here for? You know, what are you here for? And I've had so many parents say, I've tried to talk to my pediatrician, I've tried to talk to my doctor, and they don't want to listen. They tell me I don't know, or what I'm wrong about what I'm seeing. I think that's backwards. Parents are the ones who know what happened. So then we also look at the growth curve. Oftentimes you'll see a child who's going up on the growth curve, and their growth and development looks like it's right on target, and then they'll get sometimes around 12 to 15 to 18 months, around the time when they get the MMR vaccine, all of a sudden their head circumference will start to get bigger. So you'll see a jump in the head circumference and you'll see a drop in the weight. And that's an indication that they've got some brain swelling. They might have some gastrointestinal stuff that's affecting how they're absorbing their nutrients. So all of those things are important information. We want to look at old lab and clinical records, photographs and videos. Actually, I posted something on Facebook. A child who had very sadly died after I think it was 8 days after vaccines at the age of 4 months, I think it was. And the parents had taken pictures of her prior to the vaccines and then taken other pictures like 4 days after the vaccines. And you can see there's an asymmetry in her face. And one side of her face is drooping, and she had had a stroke. So you want to take pictures of children before and after. So if you have those, those are always good to look at too. And then, of course, the parental interview and the observation of the child. Okay. Okay. Next. Oh, I'm waiting for you to turn, and I've got the thing. I'm sorry. I zoned out there for a moment. It happens. Okay, so the history. I want to know about the family history. I ask about a lot of questions about family history, particularly autoimmune disease, autoimmune problems, gastrointestinal problems, allergies, insulin-dependent diabetes mellitus. A few years back, several years back actually, at the Autism Research Institute, they've been collecting information since 1967 about family history and that kind of stuff. They found a very high incidence of autoimmune disease in the mother of children who developed autism, and the most frequent autoimmune disease was autoimmune thyroiditis. I think that is, my personal belief about that is that that's probably related to lead exposure, because lead destroys the thyroid. So, and lead is a heavy metal, and lead mimics calcium, so it's stored in bone, and it is passed to the fetus in utero, and it is passed through breast milk because it mimics calcium. It's also synergistic with other toxins, including mercury and aluminum. So if you have someone who is already has a history of lead exposure or lead toxicity, which was the case in our family, that child is going to be more vulnerable to significant injury from smaller doses of other heavy metals, including mercury in vaccines and aluminum in vaccines. Okay, so I also want to ask for the same reason. Does mom have mercury amalgams? Those, the silver, we call them silver fillings. Those have mercury in them, and they continue to give off mercury as long as they're in your mouth. So that is another source of mercury toxicity that causes a synergistic effect when a child is exposed to other metals. Did mom have vaccines during the pregnancy, including the flu vaccine and the DTaP or Tdap vaccine, which would be the adult, the tetanus, diphtheria, and acellular pertussis vaccines? Tdap has aluminum, 1,500 micrograms of aluminum in it, and flu shots, the majority of flu shots still have 25 micrograms of mercury in them, 50 micrograms of thimerosal and 25 micrograms of mercury. So in any of the places that you go, CVS, Walmart, any of the big box stores or health department, college campus health centers, they all use multi-dose flu shots. So everybody's getting mercury in their flu shots. Want to know about diet, and diet in particular. You know, was mom sick during the pregnancy? Was she vomiting all the time? Did she crave certain things? Did she crave ice, which is an indication of an iron deficiency problem, which is very common with people who have lead problems. Neonatal, we want to think about birth trauma. Was the baby delivered by a C-section? Cesarean section birth prevents the baby from passing through the birth canal, obviously, and so the baby's gut is not colonized with that good bacteria that we need in order to fight off the bad guys. Want to know if it was a vac birth, or was the baby sunny side up? You know, how all of those things are important to know. Did the baby receive vaccines? Most babies get the hepatitis B vaccine on the first day of life within 12 hours of birth. Hepatitis B is a sexually transmitted disease. Moms are checked for hepatitis B during their pregnancy, so there's absolutely no reason for that vaccine to be given to these infants. And it used to contain mercury. Now it contains 250 micrograms of aluminum, which is way beyond the FDA limit for aluminum the FDA limit for aluminum in parenteral solutions or IV solutions is 5 micrograms per kilogram of weight. So a baby, about a 10-pound baby should be able to handle about 30 micrograms of aluminum. So a newborn is getting 250 micrograms of aluminum in a hepatitis B vaccine. And that damages the liver and the mitochondria in the liver. So I want to know, was the baby breastfed? Did the baby have colic? That's one of the very frequent things we see of colicky babies. Did they have reflux? Were they spitting up a lot? Projectile vomiting? Did they have trouble sleeping? Was this baby, you know, wonderful and put together, and then all of a sudden something happened? Or was the baby colicky from the beginning, or what? So then we want to think about environmental. You know, what's the water like? Do you live in a house that was built in 1800s and you have lead pipes? Do you live in a house, do you have water in your basement? Do you have mold? Do you live in areas where you might have been exposed to tick bites? And our air is a huge thing here, because we have, most people who live here don't realize, we have the highest concentration of coal-burning power plants in the world outside of China, within a 50-mile radius of Evansville. And we have a lot of heavy metals in our air. We have a lot of sulfur dioxide. We also have a lot of pesticides. So it's kind of the perfect storm here from the environmental standpoint. And I want to know about parents' and grandparents' occupations. I've had some people tell me, you know, well, vaccines don't cause autism because my child was never vaccinated and yet they have autism. And so I'm really interested in that. So I want to know, what does your husband do for a living? You know, is he a coal miner? Is your husband working in, or did your father work in a coal mine? Do you live near where somebody's tracking in coal on their shoes and on the floor? Is your child exposed to heavy metals in another way? And in every case that has been a question in the past, we've been able to track it to that. Okay, and this is a term that I want everybody to really think about: epigenetics. Epigenetics is the combination of genetics and environment. So when we think about genetics and we think about why some areas of the United States have higher rates of autism than other areas, it's not a genetic epidemic, it's epigenetics. Okay, so some specific history, things that I look for is onset and triggers. You know, again, was this child put together and really wonderful and slept well and ate well and making good eye contact, very social, and then all of a sudden something happened and that stopped? I want to know about the diet and cravings and reactions. So is this a child, whoops, most of the children that I see, where did we go here? Most of the children that I see, I can tell you when they come in, I can tell you what they eat. You know, they eat macaroni and cheese, they eat pizza, they eat chicken nuggets with gluten, they eat French fries, they'll eat pasta, spaghetti, they love ketchup, some of them love pickles, they'll drink pickle juice. You know, they have certain grapes and apples, and parents are like, how do you know that? Well, because I can see this child has a probable yeast overgrowth in the gastrointestinal tract, and they're craving things that they're addicted to, and they're craving things that feed yeast. So there's lots of cravings for carbohydrates, lots of cravings for sugars, lots of cravings for fermented things. I want to know about the stool. We talk a lot about poop, and it doesn't matter how old you are. I want to know how many times you poop per day. What does it look like? Is it big or small? Is it little round pellets? Is it soft or hard? Does it float? What color is it? And all that kind of stuff, because all of those are clues about what's going on in the gut. A lot of times, constipation is rampant. That's why it's number one. Constipation, diarrhea, encopresis, overflow around impacted stool. Some parents say, well, my child's not constipated, because they'll go for 3 or 4 days without having a bowel movement, but then all of a sudden they'll have diarrhea. That is usually a sign that the child is constipated. There's a plug, and the liquid stool is coming around that. So we have both. I want to know about illnesses, injuries, and medications, vaccine reactions, and what signs and symptoms you're seeing. And all of this comes off the questionnaire. I have people fill out the questionnaire, then you come in, and then that questionnaire is kind of like a guide, and we go through and then ask more questions depending on what answers you have to those questions. Let me just go back to this one here. Vaccine reactions, vaccines and reactions. One of the things that actually saw a child today for the first time, and Mom was telling me about when he was a baby, and she said he would just throw himself back and arch his back and throw his head back. And this was throughout his infancy and early childhood, and he would just arch and scream and throw his head back. That's a sign that we now know is associated with encephalopathy or brain swelling, and that is a frequent reaction to vaccines. Historical clues and physical exam pearls of gut dysfunction. So we're looking about how the gut functions. This is one of the things that's really important about autism and about vaccine injury. Autism has always been thought of as a brain problem that affects how the child behaves. Autism is now, and it's not just autism, it's autisms, because it can be different kinds of triggers and different sorts of things in different children, depending on that interaction between genetics and environment. So, and that's why we call it a spectrum. Every child is different. Not every child responds to the same things. But one of the things that we're certainly looking for is gut dysfunction. The gut, the gastrointestinal tract, have you guys seen that commercial where, can't think of her name, Erin something or other, and she's talking about how 70% of your immune system is in your gastrointestinal tract, and that's true. And it's not just the immune system, it's also where your neurotransmitters are formed. So the brain is actually, we call it the brain being downstream from the gut. And if you have an injured gut, then your brain is not going to work appropriately. So with the gut, healing the gut, healing the gut, healing the gut, really, really important. So thinking about severe colic, frequent vomiting, milk-based formula intolerance, babies who can't tolerate milk formula. And so that's one of the questions on the developmental history form. Did your child was your child breastfed? Were they bottle fed? When did you wean from the breast? Did you have trouble from different formulas? Did you have to go from one to another? It's very common to have multiple changes in formula and soy formula. And soy is terrible. My daughter was on soy formula. She couldn't tolerate milk. I had a hard time breastfeeding, which I realize now is because of the lead exposure. But soy formula is very high in estrogen. Little boys should never be on soy formula. Nobody should ever be on soy formula. They put high amounts of manganese in soy formula. And the reason they do that is because manganese glows in the dark. And they put it in the soy formula so that they can turn out the lights and hit it with a black light, and they can tell if the powder is, how well the powder is mixed up. So the amount of manganese in soy formula is, depending on the maker, is somewhere between 80 and 200 times the amount of manganese in breast milk. Manganese is a very important mineral in trace amounts, but when you get too much manganese, it's very toxic and it attacks the mitochondria. And mitochondrial disorder is very prevalent in children with autism. Okay, so then, and GERD, gastroesophageal reflux disease. That's this is a pet peeve of mine. GERD is not a disease. GERD is a symptom of something that's going on in the gut. That's my peeve. Failure to thrive. A lot of children diagnosed with autism are also diagnosed with failure to thrive, which means they were below at some point or another, they fell below the 10th percentile in weight. My daughter was diagnosed with failure to thrive. Wasted buttocks. They'll have a lot of times they'll have little big bloated bellies and these little bitty tiny legs and no fat on their buttocks. And that's a sign that they're having some problems with how they are processing essential fatty acids and probably how they're processing fat-soluble vitamins like vitamin E and vitamin A and vitamin D3 and vitamin K2. And those are vitamins that are very important for functioning, particularly for brain functioning and for the immune system. And if they're not processing fats very well and they have this weird fat distribution, then that's one of the clues that we look for that. And then I talked about distended abdomen, doughy and bloated bellies. We see all these kids now with these big, the children with these bloated, look like cellulite bellies. That's wheat belly. We call it wheat belly. And that's a problem with being able to, they're craving wheat, they're eating all of this stuff, and it's giving them this very unusual, or used to be unusual, fat distribution. So a lot of children they'll have strategies to put pressure on their abdomen. You'll see them, they'll lean over chairs or on the side of the couch, Or if you have exercise balls, they'll get on the exercise ball and they'll put pressure on it. And you'll notice that they might do that like after they eat. So they'll put pressure on their abdomen. They'll lay on their bellies and put pillows underneath pillows on their belly. Also, hands in their pants, putting pressure and probing because they're in pain. Gut dysfunction is also, as I said, diarrhea, constipation, grainy stools. Some children, the parents will say, well, that stool's it's just really sticky and I can't, when I try to wipe them, it doesn't come off and it's sticky and it looks like there's sand in it. That's a sign of taurine deficiency, and taurine is an essential amino acid, and it's involved in how, whether or not their bile salts are working, and a pancreatic issue. So all of these things are related. So this is why I talk about poop so much, because I want to know all that stuff, okay? Frequent, and taurine is one of the things that when you have insoluble bile salts and taurine deficiency and problems with the pancreas producing those enzymes, that can lead to not breaking down fats appropriately. And that's really important because the brain is mostly fats. So if you're not breaking down fats and not using them the way that, if your body's not using them correctly, then your brain's not going to function properly. A lot of these kids will have frequent antibiotics. They have ear infections, upper respiratory infections, tonsillitis, stomatitis, gastritis. They have all of these itises, and they get all of these antibiotics, and a lot of them are also on steroids because they develop asthma and allergies, and so they have all of these things, and the antibiotics and the steroids wipe out the gut flora. So it's just a domino effect, and it continues and continues and continues, and they get worse and worse. Signs of yeast, and yeast comes from frequent antibiotics and that abnormal flora. So the signs of yeast include rash and peeling on the feet, ridged, discolored nails, inflamed cheeks, red anus, a red ring around the anus, and ringworm, and cradle cap. Okay. So we're looking at now immune dysregulation. What kinds of things would we look at to determine, does this child have an immune system problem? Eczema and dermatographism, where you kind of use your fingernail and sort of write on it and it raises up, really easy raising up. Okay, so, and eczema, obviously, the patchy, dry skin. Eczema is very, very frequently a sign of gluten intolerance, and intolerance to gluten and other grains. And gluten intolerance makes people mean. If you have a child who's aggressive and mean, a lot of times it's because of gluten. Allergic rhinitis and asthma. Warts. Warts are caused by viruses. And a lot of the children that I see who have an autism diagnosis also have a history of warts, or their parents will have a history of frequent recurring warts. And that's a sign that maybe there was a virus that was passed in utero. Molluscum contagiosum is a skin infection caused by a virus. Herpes, and I'm not just talking about cold sores or genital herpes. There's herpes family of viruses is a whole bunch of different viruses, and these viruses have been around for a long, long time, but they didn't used to be real problematic until we started messing up with the immune system and injecting lots of other viruses and bacteria, and our food system has gone. Our foods have become very low nutritional value, GMOs and all of that kind of stuff. So now we're just more, our immune systems are more fragile, and things like HHV6, which everybody gets HHV6. If you go tell your pediatrician, I think my child has HHV6, and your pediatrician will probably say so. Everybody gets HHV6 by the time they're 5. In the 1980s and 1990s, in the late 1980s, the only people that were for whom it was problematic if they had HHV6 were people who were diagnosed with AIDS, HIV infection and AIDS. Now we have a lot of children who are diagnosed with primary immune deficiency syndrome and other deficiency syndromes, including children who have autism and immune problems. And so for them, these are big deals. So we have HHV6 and cytomegalovirus and Epstein-Barr virus. So we've got viruses that didn't used to be such great big deals, and now they are much more problematic for these children. History of chickenpox. They'll get the chickenpox vaccine, and then they'll get chickenpox. So that's an indication that they're having a different immune response to the vaccine than other people are. So there's something different about these kids. Frequent strep, bronchitis, and tonsillitis, and frequent strep, bronchitis, and tonsillitis in family members, including parents. You want to know all about that. And they'll have recurrent ear infections. My first child was born in 1981. He had one ear infection in his life. My second, but the 1981 schedule, if you look at the 1983 vaccine schedule, that's the one that I was able to find that goes back the furthest. The 1983 vaccination schedule, children got 23 vaccines from, they didn't get them at birth, so 23 vaccines from infancy to age 18, 23 vaccines. Now, according to the 2014 schedule, they get 26 vaccines from birth to 6 months. We didn't used to see recurrent ear infections. That wasn't normal. It wasn't normal. Now it's just, everybody has them. No big deal. That's the new normal. Okay, so other exam clues that I'm looking for, things like zinc deficiency. Zinc deficiency shows up as acne, sparse hair, psoriasis, white spots and lines on the fingernails, canker sores. Other things that are associated with zinc deficiency is children who have they're very tender-headed. They don't want their hair brushed. And let's see what else is. Teeth grinding is also a sign of zinc deficiency. Essential fatty acid deficiency shows up as keratosis pilaris, those little red bumps on kind of like chicken skin on the upper arms and legs. It also causes, it's very common in asthma and allergies, so essential fatty acid deficiency is a very big thing. Also dry, coarse hair and splitting, peeling nails. Splitting, peeling nails can also be a biotin issue. All right, so magnesium deficiency, things like muscle twitches and tingling. Children who they're falling asleep and they jerk a lot in their sleep, or as they're falling asleep, that can be a sign of magnesium deficiency. Frequent heavy sighing, like a pregnant woman, that's a sign of magnesium deficiency. Salt craving, chocolate craving. Chocolate's high in magnesium, if anybody didn't know that. That's part of the reason sometimes we crave chocolate, because we really were magnesium deficient. And irritability, anxiety, hyperkinetic behavior, and seizures are all signs of magnesium deficiency. All right, so these are some of the diagnostic labs that we do. We sometimes do a urinalysis. There's certain things, it's not always all of these, but we always do a CBC, we always do a chem screen. We're looking at liver and kidney function. We want to see if this child is, if their liver and kidneys are overloaded, because if they have a high load of toxins, then we want to make sure that their detoxification organs are working appropriately. We look at the thyroid panel. We frequently have kids who have thyroid out of whack. And really interesting, we often see thyroid panels come back in the normal range. And we don't just look at TSH, we look at the whole thyroid panel, and we look at balancing that. But we'll often see the thyroid panel looks normal, but then on a hair analysis, which I absolutely love, their thyroid ratios will come back way out of whack, which means there's something going on the cellular level that we're catching before it shows up on a blood test. So we can work to balance that before it becomes very clinically significant on a blood test. Iodine is one that I'm adding. I was just recently looking at some information from a doctor who's been testing all of his patients for iodine deficiency, and he's finding that 95% have low iodine, which is very, very important for brain function. We look at iron and ferritin, zinc and copper. We want to balance those. That's very high for that to be out of balance. We look at histamine levels. Some children have very low histamine. Some children have very high histamine. So we want to balance the histamine and look at what they might be reacting to. That's a sign that they have a high amount of inflammation. And we look at cholesterol. Sometimes there are a subset of children with autism diagnosis that have very low cholesterol, and that's a problem because, again, cholesterol is that fat. We want the brains to work well, so we need the cholesterol to be optimized. And very, very frequently we have low vitamin D, and if it's not technically low, out of range, it's close to being out of range, or it's not optimal, so we want to bring that up to optimal levels. Methylmalonic acid is something we look at for B12 levels, because if you just get a measure of B12, it's not going to really tell you much. You can't tell a whole lot from a B12 blood test. So methylmalonic acid is, if it's high, then that means you have a low B12. And look at vitamin A, ASO, anti-DNAs. These are strep titers and related to pandas, and immunoglobulins if we want to assess immune function, and we look at viral titers. And this is really interesting. I have, it's really fascinating to look at the viral titers of children who, when you look at their vaccine records and then you look at their viral titers, you'll see some children have measles titers that are off the chart. They're way, like you might have to demonstrate, in order to demonstrate immunity, it would say, you know, that the measles titer needs to be like 24, and these kids are greater than 300. So that's an indication that part of what may be going on with them is that maybe they have a chronic measles infection. Other kids have a 4-year-old that just got her viral titers back a couple of weeks ago, and she was fully vaccinated she's 4 years old now. She was fully vaccinated at birth with the 3 hepatitis B series, the 3-shot series for hepatitis B, has 0 evidence of immunity. She also got both varicella vaccines for chickenpox, 0 evidence of immunity for those. So there's no evidence that, I mean, for her, all she got was a lot of aluminum and live viruses. Okay, so common lab findings include high copper, low zinc, low magnesium, low iron, low vitamin A, low vitamin D3, high IgE eosinophils, which is an indication, can be allergies, inflammation, can also be parasites. Eosinophils will cause high parasites. High eosinophils will be caused by parasites. And then high MMA, which is that low intracellular B12. These are some functional medicine labs that we do. Almost always do a urine organic acids test, and that's a test that it tells us metabolites from yeast and bacterial overgrowth in the gastrointestinal tract. It will tell us oxalates, which are oxalate crystals can cause pain in the eyes. They can collect in the brain, and they are neurotoxic. So we want to look at that, and they're also produced by yeast. The organic acids test I love the organic acids test because it also tells us things about how the child might be detoxifying. It gives us measures of nutritional status and vitamins, and also different toxins and things. So it's a great test. I love it. Comprehensive digestive stool analysis is what we look for. We look at, again, at yeast. We look to see if there's evidence of parasites or of some really nasty bacterial infections in the gastrointestinal tract. And it's very helpful in telling us what pharmaceutical and herbal agents we might be able to use to tackle those yeast bugs, because we want to use what works on those guys. IgG food antibodies, including anti-gliadin antibody. A lot of these kids have IgG food allergies. The ones that are most common are wheat and gluten, corn, soy, dairy, so milk, cheese, what else? Soy, did I say soy? So yeah, so soy, dairy, wheat, gluten, yeast, sometimes eggs, a lot of times eggs, egg whites or egg yolks. So, and then sometimes we get some weird stuff back. We'll get kids who have never had asparagus and they're allergic to asparagus. So we don't know why, but sometimes it has to do with what things are cross-pollinated. So they might be allergic to environmental, like wheat, trees and grass, and then they'll show up with an allergy to a certain food because it is pollinated by bees that are visiting the grass and that kind. So it can get really interesting when you start looking at, you can kind of look at what they're allergic to and make some kind of inferences about what sorts of things might be going on in that way. Hair analysis, probably my favorite. No, probably my favorite. Hair analysis is I love this test. It is so non-invasive, so we don't have to do a lot of sticking or anything. It's relatively inexpensive to do. It's easy to use as a tool to follow progress over time. You can repeat it every 3 to 6 months, and it gives you an idea of what's going on a cellular level over time. Whereas a blood test tells you what's going on today, hair analysis tells you what's going on over 3 months. So love that. And you can do all kinds of things with it. We look at toxic exposures. We look at, the signature of mercury, which is dysregulated minerals. Really, really good test. A lot of people don't like hair analysis because it's very time consuming. That's probably why I like it, because I understand it and I know how to do it. Urine amino acids is another very good test to check, particularly as we go on. Urine toxic elements can show us what's coming out. I don't believe in doing what some doctors and professionals who are doing this kind of work will do something called a urine provocation test. I am not a fan of a urine provocation test. I don't like them because a lot of the kids have problems detoxifying. They can't get rid of stuff, which is why we're having this problem in the first place. There's something going on that's keeping them from detoxifying. So if we give them a chelator that pulls stuff out of hiding places and it recirculates throughout their body, if they can't get rid of it, it's just going to redeposit, which means some of that's going to go into the brain that wasn't there before. So for that reason, would never be a proponent of doing a provocation test. MTHFR genetic screen. This is just a screen that we do that tests for the 2 most frequently identified genetic SNPs in the methylation pathway. What? The methylation pathway is one of 2 detoxification pathways. There's methylation and transsulfation pathways. If they're not working right, you don't detoxify, you don't use folate or folic acid the same way as other people. So the children will have a cerebral folate deficiency, and they're not using their B vitamins well. It's kind of like just gears that get stuck and they don't turn the way that they're supposed to. MTHFR stands for methylene tetrahydrofolate reductase. And if somebody has an MTHFR deficiency, then they have methylene tetrahydrofolate reductase deficiency syndrome. So what people say who are doing this, will say, well, we're just going to do the screen because we're going to look at C677T and A1298C, because those are the ones that are most frequently identified when we test for MTHFR. I say the reason that those are the most frequently identified is because those are the ones that are most frequently screened for. That's what you're looking for, that's what you're going to find. So we do the screening and then we go from there. And I'll explain that when we get to the next. Okay, so these are some secondary kinds of things. Premier Autism Panel is a way comprehensive test. Urine, hair, fecal metals is something that we can do as we move forward to see where we are in the detoxification trip. Urine and red blood cell minerals, plasma amino acids, plasma fatty acids, and comprehensive methylation pathway analysis. This tests for 30 genetic SNPs. SNPs are single nucleotide polymorphisms that affect how a child detoxifies or how an adult detoxifies. This is something that I think is extremely important. We take that screening, the MTHFR screening, and we look for 30 of those SNPs. And we look for things, and particularly in this area, I think it's extremely important because what we have here in this area, because we have such high sulfur in our coal and we have so many coal burning power plants, we have a whole lot of sulfur dioxide in our environment, and that causes people not to use sulfur very well. So there are certain SNPs in this methylation pathway that I think it's very important for us to evaluate for and to address, because if you don't do that and you start supplementing just to hit those MTHFR mutations, then you can have a very bad reaction. You can have, or you can have no reaction. You can have no success. So I'm a big fan of that one. So common lab findings: low lithium, and this is not prescription lithium. This is elemental lithium. Elemental lithium used to be prevalent in the soil, so it was in our food. Elemental lithium is a natural antiviral for herpes viruses. We don't have it in our food anymore. Almost everyone I see, adults and children alike, are flatlined on their lithium levels, on their hair analysis, which is part of why we have so many people with chronic Epstein-Barr viruses and chronic cytomegaloviruses, HHV6, all these viruses that are associated with chronic fatigue syndromes, not just autism. Chronic fatigue syndrome, fibromyalgia, all those kinds of things have to do with, in many cases, these chronic viruses. So we look at the lithium. It's very, very important to assess lithium and to bring it where it needs to be before you start supplementing with B12, because if you supplement with B12, B12 depletes lithium. And if lithium is already depleted and you start supplementing with B12, then you're going to bring lithium down lower, and lithium is essential for walking folate into the central nervous system. So it's all about assessing those things and treating them in the right sequence. Low selenium. Selenium is really, really important. It's natural antiviral. It's great for the immune system. It is also a precursor to glutathione, which is very important for detoxification. Low folate, low essential fatty acids, low glutathione, low vitamin C and vitamin D3, low B vitamins, particularly riboflavin. We're seeing a lot of low riboflavin. And the thing about riboflavin and thiamine and these B vitamins is a lot of people are doing gluten-free diet. So they take away the breads and the grains and that kind of stuff. And that, if they're not supplementing correctly, then they're not going to be getting those B vitamins, because that's where all of those fortified with those B vitamins, that's how our kids have been getting them. So if we're doing gluten-free and we're not looking at the B vitamins and supplementing very carefully, then we can induce a problem there where there might not have been one. But the B vitamins are also, they're synthesized in the gastrointestinal tract. So if you have those yeast and problems with overgrowth in the GI tract, then your B vitamins are not going to be where they need to be. And they're very, very, very important for brain function and central nervous system. So we'll find high yeast and bacterial metabolites, high viral titers or no viral titers, high IgG antibodies to casein and gluten. And casein is the protein in milk and dairy, and gluten is the protein in wheat and other grains. And we'll find frequently autoantibodies, so evidence of autoimmune disease. And that happens, autoimmune disease happens when the body is, oftentimes when the body is so confused because it's got so many things to target